Good morning.
Good morning.
Oh, let's get rid of that. All right, so I'm going to start just with going over some of the basic elements of trust. So we know that trust is an essential component of any interpersonal relationship, but as Gwen just mentioned, it's integral to the relationship between the physician and their patients. It increases willingness to seek treatment, to disclose sensitive information, to adhere to medical recommendations, and most importantly, to share decision-making authority. Healthcare is particularly vulnerable to deficits of trust, and trust and reputation are important indicators of institutional health at both the provider and the facility level. How do we define trust? In healthcare, trust is grounded in having confidence and security in eliciting a response from another person, and it's an expectation that the other person will behave in a way that is beneficial or at least not harmful, and it allows for risks to be taken based on this expectation. So with the survey that we recently launched, we had a few questions of interest. So we wanted to know, can we identify the level of trust in the population served at PAF? With this information, can we as a group discuss ways that we can enhance trust among both patients and providers? And can we develop resources to address and/or enhance levels of trust during patient-provider interactions and conversations? So here are the preliminary results from our recent survey. So our questions were actually embedded into a larger survey that was examining the impact of diagnosis on employment and workability. It was disseminated via email to over 13,000 patients served in 2018 and 2019. We had almost 3,500 patients complete the survey, which is a 26% participation rate, which for us is pretty spectacular. The survey was open in October and November of this year. Each individual received an invitation via email and 2 reminders if they hadn't completed the survey. To increase participation, we've started to offer incentives for participation for our patients. And with the quick turnaround, I'm actually only going to present data on the first 2 weeks of our data collection. So looking at our demographics, it's actually fairly representative of the individuals that are served at Patient Advocate Foundation. We have almost an even split between men and women. We have good representation from our African American and Hispanic patient populations. Income, almost 80% of those patients are under $48,000, which we would expect. Most of our cohort is over the age of 56, and most people reside in a household of 1 or 2. We have a pretty good representation of different locations across the U.S., including rural, urban, and suburban. Almost 80% of our cohort has either some sort of college or full college degree. We do predominantly serve patients in the South, and our top 5 diagnoses for this particular survey were cancer, HIV, hepatitis, pulmonary conditions, and autoimmune diseases. So how did we capture data on trust? We approached it in a couple of different ways, and we started with using a validated tool called the Wake Forest Physician Trust Scale. This scale describes the association between physician trust and other constructs, and it's 10 items that are scored 1 to 5 that creates a range of 10 to 50, with a higher score yielding greater trust. So these are the 10 questions that are in the survey tool. There are 3 items that are actually reverse scored. It's the 2nd, the 3rd, and the 7th. And as you can see from the red boxes, our responses have skewed in the directions that we would anticipate with a higher level score. So the cohort in general probably is skewing somewhere to between 38 to 47, but we're still working on the programming of being able to calculate and project the distributions of all the individual scores. The second series of questions that we looked at were from the CAHPS Health Plan Survey. And these include several measures of patient experience, but we focus predominantly on pulling questions from how well doctors communicate. So looking at the first 4 questions, which came from the CAPS survey, we can see that patients scored very highly, thinking about in the last 12 months, how their doctor explained things, did their doctor listen, did their doctor show respect for them, and did the doctor spend enough time with them? Interestingly enough, we added a 5th question to this series asking how often did your doctor ask you about your preferences regarding how you want medical information discussed? As you can see, we had quite a few individuals select never, which looks very different than the 4 items listed above. The final set of questions that we included in the trust part of the survey were actually created by our team at PAF and NPAF. We developed questions to examine provider trust, insurance provider trust, overall healthcare system trust, social service organization trust, and then experience with provider bias and the sources of those bias if they indicated they'd experienced it. So looking at the elements of trust that we examined, we used a scale of 0 to 10, and we asked patients to tell us what their level was. You can see very clearly that trust on an individual level scored very highly, and you can see that in the lower numbers, healthcare overall and insurance, the trust level was much, much lower. Thinking about provider bias, we asked patients a single question if they felt that they had ever been treated unfairly or negatively. 13% of our cohort indicated yes, all of the time or sometimes. And then we had a follow-up question that allowed them to multi-select how they felt or what those sources of bias were. As Gwen mentioned earlier, disease or condition, income or ability to pay, age, were the top 3 responses, and you can see how race, ethnicity, orientation, sex, physical traits such as weight, education level, non-English speaking, identity expression, or religion, how those skewed out as well. So, in summary, patients tend to have greater trust in people than in systems. Providers' ability to communicate scored high. However, there is still a disconnect with patient preferences regarding how they want to have these discussions. Trust responses are not universal. Unfortunately, I had to cut the slides where I actually looked at some of those elements by the different demographics, but we do know from our preliminary look at our data that demographics such as race, ethnicity, insurance type, age, and diagnosis affect this, so they must be taken into consideration. Provider bias was most strongly associated with diagnosis, ability to pay, and age, and those are key elements that must be taken into account during patient-provider conversations. So finally, I would like to thank my colleagues who are sitting here in the room today with the development, the management, and the analysis of the data shared with you. Thank you. Yes, questions? Yes.
Hi, thanks for sharing all of that data. Question for the provider surveys. Were we looking at specifically primary care, or was it across specialties?
So we asked the patients to think about their doctor.
Okay, so however they would define that.
Correct. Yes.
Yeah, so just a question about, you said you had some examples of, well, if you had examples of things that they felt discriminated against in the other category, do you have some examples of what they said were other than what you had listed?
They had a tendency to describe a specific experience that they'd had with a provider, so it didn't necessarily correspond to one of the categories, but it was more of a narrative. Yes.
Folks that you surveyed were part of the network, or locations that are affiliated somehow with this organization, is that correct?
Yes, ma'am. So all of the people we surveyed are individuals who've received some sort of service from Patient Advocate Foundation in the last 2 years.
And you mentioned that you knew some of their demographics.
Correct.
Were you able to sort of analyze what those folks' demographics were in that list, the full list, against what was coming out, what you were asking about, just to see if that was potentially doing?
We haven't had time to do that yet. We just closed the survey at the beginning of November, so, but we will, yes. Thank you. All right, last question, Nicole.
Do you think from the survey results, is that going to change anything, like operationally, for how maybe the PIF case managers talk to patients, or will that inform the education around how patients can communicate more effectively with providers?
I think the information from this survey will probably feed into some of this, either skill building workshops or other sorts of tools that we can create to improve the level of patient-provider trust from both sides. Thank you so much.